Let's bring in our in-studio guest into this discussion. He's Dr. Aaron Hoffman, Medical Director with the Center for Minimally Invasive Surgery at Buffalo General Hospital. Dr. Hoffman, welcome. Thank you for coming in. When you look at obesity, I mean, we're talking about fat people. When you look back at all of the ailments that have afflicted us over time, I mean, when I was a kid growing up, we were worried about chicken pox. Now we're worried about people being too fat. How did we get to this point?
Good morning, John. Good morning, Susan. We have about 72 million Americans that are obese in this country, and there's a lot of stigma associated with that culturally and socially. But most importantly, and the reason the focus of the medical community is on obesity now, besides the fact that those numbers are increasing, is that you have a 50 to 100% increase of early death. And the reason we focus as bariatric and metabolic surgeons on weight loss surgery at Buffalo General is because that early death can be attributed to high blood pressure, diabetes, and all the associated disease states. The watershed event with this House of Delegates voting that actually obesity is a disease state will allow doctors at all levels to treat patients and actually bill for services for obesity as a diagnosis.
Tell us about your at Buffalo General, how business, I guess, has increased there for obesity surgery.
Right. Every year over year, over the last 7 years, we have grown our program, and we actually used to call it weight loss surgery. And about 5 years ago, due to the beneficial health effects to the patient's metabolism, on a national level, we actually call it metabolic and bariatric surgery. And really what the surgeries do now is actually speed up the patient's metabolism, and it's a recognition that this is not a problem of personal responsibility, but rather a chronic disease. So most people in society, if they see someone who's overweight, they make a lot of assumptions that that person eats too much and exercises too little. And the science actually shows now, and this American Medical Association recognition of obesity as a disease state actually reinforces the science, and that is that some patients are predisposed to this, and some patients' metabolisms are not functioning well.
Well, let's look at this as maybe connected to some kind of social issue. I mean, let's be honest. We all walk into a fast food restaurant and we see mom and dad walk in, and both of them are extremely overweight, and they have a couple of kids, and the kids appear to be very heavy. I mean, does this run in the family?
Right. So the recognition that this is a multifactorial process, and the biggest risk of being an obese adult is being an obese child. There's been many studies to show that people come from heavy families. People even have heavier friends. So there is definitely a social aspect to this, and a lot of what we do as surgeons, it's not a quick fix. What we do is we actually educate the entire family, the patient, and make sure they bring healthier food into the home as well. So we need to fire on all cylinders, and recognizing obesity as a disease will help get the patients the help they need, from the primary care doctor all the way up through to the subspecialists in surgery of weight loss that we perform at Buffalo General.
Dr. Hoffman, let me bring up this scenario to you. A patient walks into a doctor's office. They say they're getting a cold or a sore throat. They might need some medication to deal with their issues. But now the doctor notices the patient, it might be a man or a woman, is very, very heavy, overweight, obese. Now the patient doesn't say anything about being overweight. Does the doctor intervene and say something?
Thanks, John. Even among medical professionals, the subject of people's weight can be taboo. And hopefully this recognition by the American Medical Association will lead to more discussions between the primary care physician and the patient. Many times, even doctors feel uncomfortable broaching the subject with the patient, and we have a very large segment of the population that are overweight, and yet they don't have the disease processes that go along with it, the diabetes, the high blood pressure. So a patient in their 20s that's overweight might not have those disease states yet, and if the doctor can't talk about it with them, then prevention can be a problem.
You know, the CDC has said that obesity has increased 50% in this country between 1997 and 2012. You know, that said, I mean, it's a huge problem. What is the best and most effective way to lose weight?
Obviously, surgery is the last resort. We don't ever encourage people that have not tried diet, exercise, and medical supervised weight loss with their doctor to come for surgery. In fact, one of the rules that we have is that patients need to undergo several weight loss attempts. Unfortunately, most patients that come to see us for surgery down at Buffalo General have lost 40, 50, 60 pounds several times in their life. They've lost their weight many times over, but just to have it come back. And overall, statistically, diet and exercise fails about 98% of the time. So although we do have some patients that just, do it on their own, many of our patients really want to get off that roller coaster of weight loss and weight gain, and surgery has been proven, that is metabolic and bariatric surgery, to be the most effective, long-lasting treatment available today.
But still, not everybody successfully goes through the surgery, right? I mean, it's not 100%.
Right. Well, the weight loss can be very dramatic, but once the weight is off and the patients have their health back, they need to be vigilant with diet, exercise, and actually lifelong care. And the way that our center is set up is that we actually follow those patients forever, and we become kind of one of their doctors that they see regularly.
Doctor, do all overweight people have an eating problem, or is it the way their body processes the food they eat, and everybody's different?
Sure. So the stigma of obesity is very complex. It can be genetic. It can be behavioral. Some people just don't eat right. But the underpinning of most of our patients, because obviously most of them have a desire to lose weight, and we're getting away from the idea that this is effort dependent. If only they would try harder, they would lose weight. And that's the way society views it. This recognition of obesity as a disease state, that is, metabolic disorders of the metabolism, makes it a more treatable condition, because the multidisciplinary approach between the family eating better, exercising, better food, and recognized by the family doctor and the specialists, even the surgeons, will help give better care to the obese.
Dr. Hoffman, this is where your work, where they do the metabolic and bariatric surgery. Tell us how they do this.
Thanks, Susan. There's 3 surgeons at our center. The founder of the program is Dr. Alan Posner, and my partner, Dr. John Butch, who came to us from Chicago about 5 years ago. The 3 of us perform the 3 major operations. That is the sleeve gastrectomy and gastric bypass, and sometimes we do a lap band procedure occasionally, but these are all done laparoscopically. And the reason that we need a whole center is because this is a multidisciplinary team that involves dietitians, nurse practitioners, and psychologists. It's a multidisciplinary approach.
You mentioned the word, disciplinary, and discipline has to be a major factor in post-operative and the recovery period, because you were mentioning earlier that so many people lose enormous amounts of weight, and then boom, a couple of years later, they're back where they started from.
That's right, John. That's where the follow-up is so important. With the surgery, this is not a magic pill. This is actually a lot of hard work. And with the dedication of the patient and the commitment with the clinicians, we are able to have very good success rates. The risk in the last 10 years of weight loss surgery or bariatric surgery has decreased tremendously, to the point now where the risk of death is the same as someone going in for a hip replacement. So as the techniques have become more streamlined, bariatric surgery has become more accepted. And now that the AMA House of Delegates has designated obesity as a disease state, that really reinforces the science and will allow access for more patients and the whole spectrum of treatments that we offer.
Does that mean more patients will be able to have this type of surgery?
Right. So the many insurance carriers and insurance plans, private insurance plans, don't include bariatric surgery nationally. We're very fortunate locally that the major insurers almost all do include bariatric surgery, but in the Southwest and in the Southeast, a lot of people don't have access to that care. Now, recognizing obesity as a disease state, there's going to be a lot of pressure on those carriers to offer the surgery to more patients.
You know, Doctor, obesity contributes to a lot of other diseases. People who are overweight have a tendency to smoke, from what I saw. Is that true? And I mean, if that is true, I mean, there's one problem on top of another.
Right. Well, the comorbidities of obesity, the classics are diabetes, hypertension, and sleep apnea. Those go hand in hand with the obesity. Many of our patients falsely use smoking as a diet aid. And of course, most people, when they do quit smoking, sometimes they reach for that comfort food. And a lot of people end up heavy by quitting smoking. So they do interplay. I'm not sure about having obesity and smoking linked, but all of our patients who are smokers that come to us for weight loss help. They all are required to quit smoking because after smoking, obesity is the second most treatable disease that we have in medicine.
Now, childhood obesity has increased. It's more than doubled in the past 30 years, according to the CDC. How many children do you see? Many?
Right. Well, we focus our practice on those patients over 18. And however, the pediatricians and early intervention, that is education with the parents, as I had mentioned earlier in the first segment, the largest risk of being an obese adult is being an obese child. And it definitely starts at the family level. And to have good practices of exercise and diet at an early age definitely will prevent future problems.
Dr. Aaron Hoffman, we thank you very much. We've learned a lot from you this morning. Thanks for coming in.
Thanks for having me, John and Susan.
That's Dr. Aaron Hoffman. He is the medical director at the Center for Minimally Invasive Surgery at Buffalo General Medical Center.